You wake up one morning with a slight ache in your knee. You assume it will fade, but it doesn't. Days turn into weeks, weeks into months, and before long that small discomfort becomes part of your daily life. You avoid stairs, sit down more carefully, and think twice before going for a walk. Without realizing it, your life slowly begins to revolve around pain. This is a reality for millions of people living with chronic joint and muscle pain. Whether it affects the knees, back, shoulders, neck, or hips, persistent pain does more than hurt physically. It changes how you move, sleep, work, and even how you feel emotionally. Over time, many people stop seeing pain as a problem to solve and start treating it as a normal part of life. But chronic pain should never be accepted as normal. For years, treatment focused mainly on reducing symptoms. Painkillers, rest, temporary injections, and eventually surgery if things worsened. But simply numbing pain does not fix what is causing it. Pain is your body's warning system. If it keeps returning, the underlying issue likely remains unresolved. That is why modern treatment approaches are shifting away from masking pain and toward identifying its true cause. Instead of asking how to silence pain, specialists now ask why the pain exists in the first place. Is it joint instability, weak muscles, damaged tendons, poor posture, repetitive strain, inflammation, cartilage wear? Finding the source is the first real step toward lasting relief. The good news is that the human body has an incredible ability to heal when given the right conditions. Just as skin repairs itself after a cut, muscles, tendons, ligaments, and joints also have the ability to recover. The problem is that chronic stress, poor mechanics, or repeated strain can overwhelm or interrupt that healing process. This is why many non-surgical treatments today focus on supporting the body's natural repair systems. Rather than simply reducing pain temporarily, the goal is to strengthen weakened tissues, improve joint stability, restore mobility, and create an environment where healing can happen properly. The knee is one of the most common pain points because it handles enormous stress every day. Every step, squat, stair climb, and standing motion places force through the joint. Over time, factors like excess weight, inactivity, poor movement patterns, sports injuries, and aging can begin wearing it down. The warning signs usually start small. Pain climbing stairs, stiffness after sitting, difficulty squatting, discomfort when standing up, or feeling that the knee is unstable. Many ignore these early signs until the pain becomes severe. At that point, people often assume surgery is the only option, but in many cases it is not. For mild to moderate joint problems, tendon injuries, early arthritis, and chronic musculoskeletal pain, non-surgical treatment can be highly effective when properly planned. The earlier the issue is addressed, the greater the chance of avoiding invasive procedures altogether. However, no single treatment works for everyone. Chronic pain is rarely caused by just one factor. A weak core can worsen back pain. Tight hips can contribute to knee pain. Poor posture can overload the shoulders and neck. The body functions as one connected system, and when one part becomes weak or dysfunctional, other areas compensate until pain develops. That is why a complete recovery plan often includes more than one strategy: strengthening exercises, mobility work, posture correction, movement retraining, weight management, supportive therapies, and lifestyle changes. Sometimes small habits make the biggest difference. Walking regularly, reducing sitting time, improving footwear, correcting desk posture, or learning proper exercise technique. Another important truth many people overlook is this: rest alone rarely fixes chronic pain. In fact, too much inactivity often makes it worse. Muscles weaken, joints stiffen, circulation drops, and the body becomes even less resilient. Controlled movement is often one of the most effective forms of treatment, and pain affects more than the body. Long-term discomfort wears down mental health too. It creates frustration, fatigue, irritability, and hopelessness. Many people with chronic pain stop enjoying activities they once loved because every movement becomes associated with discomfort. That is why healing requires more than physical treatment. It requires rebuilding confidence in your body. Believing improvement is possible is part of the recovery process. Most importantly, pain should not be ignored simply because you are getting older. Too many people assume joint pain is just part of aging. But while pain may become more common with age, that does not make it normal. If you have forgotten what it feels like to wake up without pain, that is not something to simply accept. It is a sign that your body needs attention. Because pain is not destiny. Pain is information. And when you treat the true cause instead of just hiding the symptoms, real recovery becomes possible. The goal is not just to survive with less pain. The goal is to rebuild a body that no longer creates it.